If we have learned anything in the past several months, it's that despite all our masking, avoiding our favorite places, and social distancing from the people we love, we still need each other. We have learned how vital our friendships and relationships are, and how much we all need compassion and care. Care is what we are all about. It is right in our name. And at WeCareJax, we deliver on our name every day. While the pandemic first sent our staff home in March of 2020, we never wavered on managing and referring our patients for critical specialty care. Thanks to our dedicated physicians, clinics, and hospital partners, we continue to ensure our patients were treated compassionately and professionally. The pandemic didn't care that our neighbors needed vital life-saving services, but we cared. That's why last year, the volume of care secured actually increased. We scheduled more than 4,000 appointments for over 1,600 unique uninsured patients facing a medical crisis. Because heart attacks, broken bones, and even cancer didn't stop just because there was a pandemic. And while our patients were experiencing not only a personal medical crisis, but also the instability the pandemic brought with it, including losing jobs, losing housing, even losing loved ones to COVID-19, WeCareJax held virtual hands, providing needed reassurance and an empathetic ear, making sure none of our patients fell through the cracks. Even amid the worst of the pandemic, we cut down on the time elapsed for scheduling, managing to secure appointments for 59% of our patients within 1 week of the request for care, and 89% were scheduled in less than 60 days. That's actually higher than our annual benchmark of 80% when there's not a national crisis. None of this could have happened if it wasn't for our physician volunteers and for you. In fact, every dollar donated to WeCareJax turned into $25.17 of donated medical care, treatment, and support for our uninsured neighbors in Duval County, at no cost to the patient or their families.
One of the things that we can be proud of is that we were able to innovate, to change the way we do business, to change the way we provide care to patients, telemedicine visits, Zoom calls in order to coordinate meetings and efforts, and it just truly shows that things work better when there is a group of people that are committed to a dynamic and wonderful cause like ours. And I'm so grateful that we were able to make those changes so that we could keep our doors open for our patients.
Innovations truly powered the last year, and finding new ways to support our neighbors in need with other organizations doing great work helped all of us meet new challenges, like fresh, low-touch produce deliveries for cancer patients in active treatment from local farmers with full fields but nowhere to sell their products.
We are grateful for WeCare, for the work that they do, to be able to partner with WeCare and organizations like WeCare to really bring our produce that has low touch, no pesticides, no herbicides, on our products, to be able to bring them right to the families, because food is medicine.
Like the physician leaders of the Duval County Medical Society, who launched WeCareJax with local media to ensure our community didn't lose sight of another virus that could weaken us while we focused on COVID. Like the nonprofits who joined together to secure emergency hotel rooms for our neighbors without addresses to recover after they learned they had COVID. And those online consultations that kept patients safely at home while connecting to their care team to hear lab results and review treatment plans. Neighbors helping neighbors. That's what WeCareJax is all about. To our volunteer physicians and providers who are the heroes of the last year, to our hospital and clinic partners, to the nonprofits shifting to new ways of helping, and to all the donors who make this work possible, you have our heartfelt gratitude for being there for this once-in-a-100-year challenge. Instead of keeping your distance, you stepped forward, embracing the mission, helping us continue to make compassionate care possible. You care, and WeCare. Together, we will work hand in hand for a brighter, healthier future.
During the course of the COVID pandemic, one of the things that we can all say, one common word, would be that we all faced a lot of uncertainty because these are unprecedented times. And what I think is really important is that the bright spot is showing that when people work together, no matter what the circumstances are, great things can happen. We can persevere and we can continue to show love and dedication to our entire community, and particularly in our case, for those patients who are in need. So that is just a shining beacon of hope and promise for all of us. And thank you so much for working together to show that we care.